Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in Ayurveda Academy YouTube channel. For paid online consultation, my WhatsApp number is 922681060. We have the expert team of the doctors. This lecture is devoted to Charaka Samhita. So those who are interested in Charaka Samhita, please try to listen this lecture for 1 hour. Very interesting lecture, because we are discussing Charak Chikitsa Sthan. It is, of course, useful for the BMS students of the second, third, fourth year, but Charak Samhita is also liked by many people in India as well as in the foreign countries. So those who are interested in Charak Samhita, please carefully interact with the, you can make a comments also side by side. Okay. So my dear friends, today Charak Samhita Chikitsa Sthan Adhyaya, or the chapter number 3. We have completed Rasayana Chikitsa, we have completed Vajikarana Chikitsa. Now we are talking about Chikitsa Sthan. It's a very big chapter. That's why maybe today's will be the last part of the Jwara Chikitsa. Okay. So in this, we will start with the shloka number Charaka Samhita Chikitsa Sthan chapter 3. Open your notebooks or your books also, textbook, and see, concentrate shlok number 200 to 203. Okay, that is related with the management of Vishama Jwara. It includes malaria, it includes typhoid also. Okay, so Vishama is irregular up and downs. The temperature आता है और चला जाता है, तो उसको बोलते हैं विषम. विषम is odd. Rhythm normal नहीं रहता, हमेशा continuous fever नहीं रहता, कभी आता है कभी जाता है. ठीक है. So I will first like to chant the very interesting shlokas. This is very important. Vishama Jwara Panch Kashaya. 5 decoctions for 5 types of the Vishama Jwara, which are called as Santata. Santata Jwara, Satata Jwara, Anyadishka, Tritiyaka, and Chaturthaka. These are the 5 types of Jwara. Let us hear carefully the original Sanskrit shloka, which are little bit interesting. Kalingaka patolasya patram katurohini. Kalingaka patolasyam patram katukarohini. Patolaha sariva mustam patha katukarohini. Patolaha sariva mustam patha katukarohini. Nimbaha patolastrifala murdvika mustavatsako. Nimbaha patolastrifala murdvika mustavatsako. Kirata tiktam amruta chandanam vishvabheshajam. Kirata tiktam amruta chandanam vishvabheshajam. Guduchamalakam mustam ardham shloka samapanaha. Guduchamalakam, guduchi amalakam mustam ardha shloka samapanaha. Kashayaha shamayantyashu pancha vidhan jwaran. Santatam satat anyadya tritiyaka chaturthagan. So विषम ज्वर नाशक 5 कषाय. पहला है संतत ज्वर में हमें देना है कलिंग का आदि कषाय. It includes कलिंग, that is कुटज, कुड़ा, patol, and katukarohini. If possible, you can make a screenshot or write down this. These are very important for our medical practice, because we are giving the bharada churna, coarse powder of these plants, which are available in the herbal medical stores, and then the patient has to prepare the decoction, fresh decoction, and give it to the patient. In Satata Jwara, this is a type of Vishama Jwara, Patoladi Kashai. Patol, Sariva, Musta, Patha, Katukarohini. These are the names of the plants. In Anyadishka Jwara, Nimbadi Kashai. Kashaya is a decoction. Quat, chai, tea बोल सकते हैं, आयुर्वेदिक टी लेना है आपको. एंटी पायरेटिक, फीवर को कम करने वाले या 5 दवा है. हम उसके भरड़ चूर्ण देकर लोगों को पूछ सकते हैं कि आपको काढ़ा फ्रेश बनाना है घर में जाकर, और वो आराम से बना लेंगे, चाय बनाते हुए इसी तरह से. निम्बादि कषाय, आजाडिराक्टा इंडिका, एंटीसेप्टिक. निम्ब पटोल त्रिफला मृद्विका मुस्ता कुटेज. मुस्ता मीन्स नागर मोथा. This is the best amapachaka dravya. Trifala is the best laxative, because if there is a constipation, the body heat will increase. So always see that the fever patient gets a vatanulomana. By that, we should not give the purgative. I am not saying give the purgative, but laxative can be given, which is the best triphala. In Tritiyaka Jwara, Kirata Tiktadi Kashaya. Kirata Tikta is a very bitter plant. Kirata Tikta, Guduchi. Guduchi, Tinospora cordifolia, immunomodulator. हमारी व्याधि प्रतिकारक शक्ति बढ़ाने वाली ये गुड़ुची गुड़वेल बोलते हैं उसको, है ना। चंदन हर एक जानता है, चंदन की चोरी भी हो जाती है, बड़े महंगी चीज है ये। चंदन का मतलब है सैंडलवुड, ठंडा ठंडा कूल कूल, पित्तग्न द्रव्य है। शुंठी हमारी भोजन व्यापार में रहता है, मेटाबॉलिक प्रोसेस स्टिमुलेट करते हैं। जिंजर बोलते हैं ना, तो जिंजर का पानी लेना भी बहुत बढ़िया रहता है, कफग्न कार्य करता है और दीपन पाचन का काम शुंठी के द्वारा बहुत अच्छी तरह से होता है। चतुर्थक गुड़ुची आमलकादि कषाय। गुड़ुची, आमलकी और मुस्ता। हर बार मैं कहता हूं कि मुस्ता नागरमुथा बेहतरीन आमपाचक द्रव्य है। अभी चलते हैं आगंतुक ज्वर। पहले से आपको पता चला है कि आगंतुक ज्वर मतलब होता है ट्रॉमा, अभिघात होने के बाद में होने वाली। 4 प्रकार की रहती है ना, अभिसंगज। उसमें ज्यादातर हम क्या करते हैं कि दैव व्यपाश्रय चिकित्सा करते हैं। चिकित्सा के 3 प्रकार तो आप जानते हैं, जैसे कि ज्यादातर युक्ति व्यपाश्रय चिकित्सा और दैव व्यपाश्रय चिकित्सा। ऐसे होते हैं ना, युक्ति व्यपाश्रय, दैव व्यपाश्रय, और वो मानसिक के लिए क्या बोलते हैं, मानसिक चिकित्सा होती है ना। ये दैव व्यपाश्रय ज्यादातर उसमें इट इंक्लूड्स द मंत्रा चैंटिंग। जो भी प्रॉपर मृत्युंजय मंत्र वगैरह जैसे होता है, यू कैन चैंट डिफरेंट मंत्रास अकॉर्डिंग टू योर ओन कुल दैवत के अनुसार आप चैंटिंग कर सकते हैं। बाद में यू कैन वेयर सम प्रेशियस स्टोन्स अकॉर्डिंग टू द ग्रह बाधा और इन्फेक्शन। देन देयर इज अ रिलैप्सिंग फीवर, है ना। आगे चलकर पुनरावर्तक ज्वर चिकित्सा। जो ज्वर, which fever comes again and again, what to do? Then we must clean the body first, and that is why here mrudu shodhana. जब भी whenever there is any disease which is getting a relapse, always try to understand whenever there is a relapse, possibility that the nucleus of that pathology remains in the body. And according to Ayurveda, it is something like an impurity. A toxic material अंदर रह जाता है. So toxin material as it is inside, we must do some basic panchakarma to detoxify your body. That is, but this is the case of fever, because fever body is already in an irritation condition. Deha manasa santapaha. So in this condition, don't give any strong panchakarma. Mrudu shodhana. Then you can give the nutritious immunity बढ़ाने वाली यापन बस्ती. It increases your immunity. लघु यूष, which is very easy to digest. है बोलते हैं ना यवागु एंड यूष। तो यवागु का होता है, these are 3 types of यवागु, मंडपेया एंड विलेपी। और यूष बना दिया जाता है ग्रीन ग्राम के द्वारा, मूंग की डाला, मूंग की डाल की बनाते हैं ना ये लघु यूष। तो ये कृत यूष हो सकता है, अकृत यूष हो सकता है। जांगल मांस रस, तिक्त द्रव्य सिद्ध घृत। तिक्त द्रव्य, बिटर जो द्रव्य है उसके साथ बनाए हुए, जैसे कि आप जानते हैं कि तिक्तक घृत नाम का है, महातिक्तक घृत भी नाम का एक है मेडिकेटेड घी, इसका इस्तेमाल आप कर सकते हैं। किरात तिक्तादिक्वात और अभ्यंग बाह्य उपचार हम कर सकते हैं। आगे उन्होंने लिखा है, चरक लिखते हैं कि पथ्य क्या करेंगे हम, ये ज्वर व्याधि में पथ्य क्या होता है। तो पहले तो हमारा जो डाइट है वो बिल्कुल लाइट डाइट होना चाहिए। Don't take any heavy food. Whenever you are having fever, there is naturally there is anorexia. भूख नहीं लगती हमें, तो उसमें you don't take too much heavy food, high calorie food, high fatty food. कुछ ज्यादा sweet substances नहीं लेनी है आपको. You can take the yavagu, the soft rice, rice gruel बोलते हैं, और ज्वरघ्न शाक, शाक का मतलब वेजिटेबल, जिसमें पटोल आ जाता है, पाठा आ जाती है, कारवेलक आ जाता है। इसका इस्तेमाल बिटर टेस्ट होने के कारण we can use दिस पर्टिकुलर वेजिटेबल्स। नाउ आगे चलते हैं। ये ज्वरहर पंच कषाय जो है ना, फिर एक बार देखिए कि इसमें आप वात काढ़ा भी बना सकते हैं, नहीं तो फांट भी बना सकते हैं। जैसे कि एक पहली वाली पेयर है मुस्ता और परपट वाली। मुस्ता मतलब नागर मोथा, बेस्ट आमपाचक है, और परपट इज ए बिटर टेस्ट एंटीपायरेटिक। देन फांट या क्वाथ किसका बना सकते हैं, शुंठी और परपट का भी हम बना सकते हैं। शुंठी का मतलब जिंजर होता है, परपट का मतलब पटोल होता है, पड़वल होता है मराठी भाषा में। देन ये देखिए आगे चलकर ये दुरालभा प्लांट है जिसको हम धमासा भी कहते हैं। ये रक्त का जो प्रवाह है वो ठीक ठाक करने वाली दवा है और एंटी हाइपरटेंसिव भी माना जाता है, इससे ब्लड प्रेशर कम हो जाता है। और परपट हमेशा की तरह पटोल तिक्त रस का है। अभी आगे चलकर उन्होंने लिखा है कि मुस्ता मतलब नागरमोथा आमपाचक है, शुंठी दीपन पाचन है, गुड़ुची इम्यूनिटी बढ़ाने वाली द्रव्य है, और किरात तिक्त बिटर होने के कारण एंटी पायरेटिक है, जिसके द्वारा हमारे शरीर की जो आम है वो निकल जाएगा। आगे चलकर पाठा उशीर, उशीर का मतलब वाड़ा होता है, एक प्रकार का ग्रास होता है वो, और उदिच नाम का एक द्रव्य है। तो इसके द्वारा हम ज्वर के लिए पंच कषाय चरक संहिता में बताए गए हैं। तो अभी हमें राइट साइड के हमारी कर्सन लेनी है और आगे चलकर देखते हैं कि पायरेक्सिया के लिए, फीवर के लिए चरक क्या क्या बोलते हैं, क्या करना है, कैसा करना है करके। वी आर सीइंग द मैनेजमेंट ऑफ द फीवर बाय चरक संहिता चिकित्सा स्थान। तो यहाँ आप देख सकते हैं कि अन्य ज्वरहर कषाय में जो नाम लिखे हुए हैं चरक संहिता में, विषम ज्वर नाशक पंच कषाय ऐसा उन्होंने लिखा है। उसके बाद है वत्सकादि कषाय, देन उसके बाद मधुकादि कषाय, जात्यादि कषाय, त्रिफलादि क्वाथ, बृहत्यादि कषाय और शट्यादि कषाय। My dear friends, these notes are in a very short manner, so there is no what you can say the again इसमें कुछ आपको छोड़ना नहीं है. There is no optional part in this. Each and every line of this note you will have to mug it up, क्योंकि ये नाम तो है, आपको याद करनी होगी कि कौन से कषाय ये चरक संहिता में चिकित्सा स्थान में ज्वर व्याधि में बताए गए कषाय है, तो उसके नाम आपको याद करना पड़ेगा। विषम ज्वर नाशक, वत्सकादि कषाय, मधु का मतलब ज्येष्ठ मधु होता है, ग्लिसराइजा ग्लैब्रा। त्रिफला तो आप जानते हैं, और बृहति नाम की एक वनस्पति होती है, बृहत्यादि कषाय। ठीक है, आगे चलकर एक घृत बताया है फीवर के लिए, जिसका नाम है पिप्पल्यादि घृत। देखिए इसका पहले इंडिकेशन हम देखते हैं। ये ज्यादातर जीर्ण ज्वर के लिए है, उसके मतलब जो एक प्रकार है ट्यूबरकुलोसिस, उसका भी हम इस्तेमाल यहाँ पर कर सकते हैं, दैट वी कैन इंक्लूड ओवर हियर। ट्यूबरकुलोसिस, कफ, शिरशूल हेडेक है, पार्श्व शूल है जैसे प्लूरसी वाली शिकायत है, अंश अभिताप है, स्कैपुलर रीजन में आपको कुछ पेन हो रहा है और ये इरिटेशन हो रहा है, तो इसके लिए अभी घृत बनाना है। क्योंकि हमेशा ध्यान में रखिए, यू ट्राई टू अंडरस्टैंड व्हेन द फीवर बिकम्स द क्रॉनिक, when any type fever, whenever it becomes a chronic, it starts drying of your body tissues. क्या करते हैं, what will happen, रस रक्त मांस मेद अस्थि मज्जा शुक्र, whatever the unctuousness, whatever fat, whatever lubrication is existing because of the संताप, अभिसंताप, irritation, शरीर मन संताप, इसके कारण when the fever goes for a longer duration, your body becomes totally dry and immunity becomes less. So to improve the unctuousness of the body, immunity of the body, we always use the medicated ghee. Don't forget that. नव ज्वर में हम घी नहीं देते, पुराने ज्वर में क्रॉनिक होने के बाद हम मेडिकेटेड घी का इस्तेमाल करेंगे। ठीक है, आगे चलकर ये देखिए कुछ तेल का इस्तेमाल चरक संहिता में बताया गया है। चंदन आदि तेल करके है, आदि का मतलब होता है एक्सेट्रा। ये देखिए सब का सब मैटर हमारे सामने प्रस्तुत हो गया। ये बहुत अच्छी वाली चीज है कि हम सब चीजें एक साथ दे सकते हैं। चंदन, चंदन का मतलब होता है सैंडलवुड, है ना, तो सैंडलवुड इसमें तेल में सिद्ध करने के लिए विच आर द मेडिसिन दैट आर बीन यूज्ड, ऑल विल बी द पित्तग्न द्रव्य है, वात पित्तग्न है। दे प्रिवेंट द वेयर एंड टेयर, दे रिड्यूस द हीट ऑफ द बॉडी। तो रक्त चंदन, श्वेत चंदन, पद्म का मतलब लोटस होता है, पद्म उत्पल, पद्म नाल, उशीर जैसा मैंने बताया, घस, खस बोलते हैं उसको इंग्लिश में, एक प्रकार की इट्स वन टाइप ऑफ द ग्रास। सारीवा का मतलब उपलसरी होता है, ये बहुत ही रक्त को कूल डाउन करने वाली मेडिसिन है। कुश, काश, इक्षु, दर्भ, ये पंचतृण कह सकते हैं हम। नल, शालीमूल, अर्जुन, जब फीवर हो जाता है तो हार्ट को भी कभी कभी क्षत पहुंचती है, तो इसके लिए अर्जुन उधर कार्डियक टॉनिक जैसे बना हुआ है। पलाश, वट, उदुम्बर, अश्वत्थ, न्यग्रोध, कदम्ब, गंभारी, धातकी, मंजिष्ठा, पुष्कर मूल, ये प्लूरसी में बहुत अच्छा काम करता है। पुष्कर मूल, शतावरी जो हमारी मसल्स की ताकत बनाए रखता है, हमारी शुक्र धातु तक उसकी एक्शन है। विदारिकंद, जीवक, रूषभक, मेधा, महामेधा, कुटज, पटोल, निम्ब, नारिकेल, खरजूर, मृद्विका, प्रियाल, प्रियंगु, आत्मगुप्ता, कपिकच्छु। सो ऑल दीज मेडिसिन आर आइदर पित्तग्न है, उसकी संताप कम हो जाएगा, हिट कम हो जाएगी बॉडी की, कोर बॉडी टेम्परेचर कम हो जाएगा। उसके साथ साथ यहां आपको कुछ न्यूट्रिशियस, क्योंकि डेबिलिटी बहुत आ जाती है। वेन एवर देर इज अ क्रॉनिक फीवर द बॉडी बिकम्स टू वीक, TOO, टू वीक, WEAK, पूरी की पूरी बॉडी डिहाइड्रेट हो जाती है ना, डेफिशिएंसी बन जाती है विटामिन की या प्रोटीन्स की। तो इसके लिए यहाँ देखिए आप, विदारी कंद है या खरजूर है या मृद्विका है, ये सब न्यूट्रिएंट्स है। ध्यान से सुनिए, न्यूट्रिएंट्स, इसको हम क्या बोल सकते हैं कि एक टर्म है न्यूट्रासूटिकल करके, उसको क्या बोलते हैं, फूड सप्लीमेंट। जैसे मॉडर्न वाले लोग विटामिन देते हैं, तो इसी तरह हम क्या लगाते हैं, नारिकेल लगाते हैं, खरजूर लगाते हैं। तो दीज आर द लाइक द फूड सप्लीमेंट्स। हाँ, सो इसकी जरूरत है क्रॉनिक फीवर में। ये कैसे बनाते हैं, ये चंदन आदि तेल, क्वाथ एंड कल्क, वी हैव टू प्रिपेयर द क्वाथ एंड कल्क एंड मिक्स दिस विद द गोदुग्ध, that will be added to the tila tail, and tail pak vidhi ke dwara, according to the procedure of medicated oil, that particular oil will be prepared, and this oil will be used for all pitta predominant problems. One of the important is dah jwara, पूरे शरीर को बर्निंग हो रहा है, eyes are burning, palms and burning, feet are burning, and there is high temperature, then you can use the abhyanga, you can use the what you can say, the strips soaked in the chandanadi tail, keep it on the forehead, keep it in the axilla, keep it on the umbilicus. So naturally, because of the cooling effect of that chandanadi tail, your inner body temperature will come down. Okay, so abhyanga का मतलब ऐसा नहीं है कि you have to massage full body vigorously, nothing. You can put the different cotton plates, cotton strips soaked in the chandanadi tail and put at the different sensitive places. Okay, now I think this is the time to go for the second page, and first we will cover the last, this left part. Here the next oil mentioned by Charaka is agurvadi tail. First हम देख लेते हैं कि अगुरवादी तेल और चंदनादी तेल में बेसिक फर्क क्या है। चंदनादी तेल जो है ना, इट्स अ वेरी कूलिंग इफेक्ट है उसका। अगरू तेल का इज नॉट डायरेक्टली कूलिंग, but basically try to control the rigor and chills arising because of the heat. So वो कम करने के लिए this is useful for the fever with rigor, उसमें आम ज्यादा होता है, ठंड ज्यादा बसती है, तो ये अगरू का तेल, चंदनादी तेल नहीं इस्तेमाल करना, उधर अगरू तेल इस्तेमाल करना है। दिस ऑयल इज वार्म एंड यूज्ड फॉर अभ्यंग और द कॉटन स्ट्रिप्स आप लगा सकते हैं, जैसे मैंने पहले कहा था। So let us see, Agaru is a little bit warmer, not cool like Chandana. Chandana is a extreme cool, but Agaru is a warm. Kushtha, Tagara. Tagara is a very special to give you the tranquility of the mind. Tagar plant is also reducing the disturbances in the mind because of the Raja and Tamoguna. So if the patient is suffering from too many dreams disturbing his sleep, then we always use the tagaradi phand. Tagar का इस्तेमाल वहां पर किया जाता है। Jatamasi is also used to tranquil the mind and antipyretic. Triphala is the best laxative. Then Ela, Tejapatra, Guguru, Devadaru, Agnimantha, Bilva, Shonaka, Patla, Punarnava, ये सब a part of like Dashamula, and they are best analgesic in Ayurveda. Okay, कंटकारी, बृहति, शालीपर्णी, प्रश्निपर्णी, ये दशमूल की बात चल रही है, गोक्षूर, एरंड एक्सेट्रा। भल्ला तक, करंज, अजमोदा। भल्ला तक इज हॉट, बट कागरू, एज आई एम टेलिंग यू, चंदनादि तेल इज कूलिंग, बट अगुरवादी तेल इज वार्मिंग, यूज यू लिटिल बिट हीट टू द बॉडी। सो देयर इज अजमोदा which is very useful for gas problem. Ardrak, ginger, pippali, sarshap, rasna is the best analgesic in Ayurveda. वचा का मतलब विखंड होता है, ये स्टिमुलेंट है, Bala, Atibala plants gives the strength to the muscles. गुडुची बेस्ट इम्यूनोमॉड्यूलेटर. ज्योतिषमती ये हमारी ब्रेन के ऊपर काम करेगी. चित्रक इसका पर्याय नाम है अग्नि, तो ये अग्निदीपन पाचन का काम करेगी. तिल कुलत्थमाश एक्सेट्रा. द क्वाथ एंड कल्क we have to make and then add it to the sura, sauviraka, tushodaka, maireya, medaka, dadhimand, aranal means kanji, or katavara are added to til and whole medicated oil is prepared. So just now I have mentioned it is used for the warming and used for abhyanga. Now next point in our discussion, we are discussing Charak Samhita Chikitsa Sthan, Charakastu Chikitsite. Don't forget that. Don't forget. Jwara Moksha Lakshana. Fever is gradually, step by step, going down. Jwara Mokshe Purushaha Pujan Vamati Cheshtite Shwasan Vivarna Sinnango Vepate Liyate Muhu. Jwara Mokshe Purushaha Kujan Vamati Cheshtate Shwasan Vivarna Svinnango Vepate Liyate Muhu. Kunjana sound, vomiting, movements of the limbs, heavy breathing, discoloration, sweating, trembling, and frequent fainting are the Jwara Moksha Lakshana. Okay? Jwara Mukta Lakshana. Patient becomes free from fever, totally gone. These are not the totally diminishing of the fever. It is gradually, step by step, it is coming down. But this is mukti from Jwara. Vigata klamasantapam avyatham vimalendriyam yuktam prakriti sattvenam vidyat purusham ajwaram. Ajwaram, no fever at all. Normal, your thermometer and reading below 98 degrees Fahrenheit. So relief from the fatigue, patient little bit better. Relief from the temperature, body temperature is coming down. Absence of the discomfort, clarity of the senses, and gaining natural mental faculty. Okay, so this is all about the. We are discussing Jwara Chikitsa, and now I have to move on the right side. But right side, I am going to just announce one thing. I am not going to take this particular class in detail of this chapter because this is the next chapter of Charak Samhita Chikitsa Sthan, that is 4th chapter. Sir, why? Why you are not taking, sir? Don't worry, I am not angry with you. I am saying that Rakta Pitta Chikitsa, this particular discussion, I have already made a video on it, and in your playlist of Charaka Samhita classes, you will definitely find this video of Rakta Pitta and also the next chapter, chapter 5th. That is, I think it is something like a Gulma. I will just check it out. But these both the chapters we have already prepared. Deshpande sir already prepared. Yes, Gulma. So Rakta Pitta and Gulma Vyadhis are already there. But still, the matter is in front of you. I will repeat few things. This is the Rakta Pitta is nothing but the hemorrhagic problem, bleeding problem. For example, Urdhvaga Rakta Pitta, Adhoga Rakta Pitta, Tiryak Rakta Pitta. Bleeding coming from the nose, epistaxis. Bleeding coming from the sputum. Tell me, yes, hemoptysis in the tuberculosis. If the bleeding comes through the vomiting, oh, vomiting, yes. Hematemesis. Hematemesis. Why? Why, sir? Esophageal varices. There are ulcers on the esophagus. Then, Adhovarakta Pitta. Bleeding problems in the menses. Polymenorrhea, menorrhagia, metrorrhagia, etc. And also per rectal bleeding. That is all included in the Vyadhi Rakta Pitta. So, and also Tiryak Rakta Pitta. For example, here, capillary bleeding on the hand. That is also possible. In the ITP, idiopathic thrombocytopenic purpura. Yes, Ayurveda Academy treats this patient. So if anybody has a problem like idiopathic thrombocytopenic purpura, please, for paid consultation, you can WhatsApp 9226810630. But this particular understanding of the Rakta Pitta or the bleeding problems, one must know the investigation which is called as a BTCT, bleeding time and clotting time. Normal bleeding time 0 to 5 seconds and clotting time 5 to 10 seconds maximum. I am sorry, 0 to 5 minutes, not second. I am extremely sorry. I am folding my hands. A slip of tongue. Bleeding 0 to 5 minutes, clotting time 5 to 10 minutes. Okay. So the basic reason is Pitta and Rakta are Ashri Sambandha. You know that. They are interlinked. So whenever there is a Pitta Prakopa Kaharvya, there will be Rakta will be Dushita. And then vasodilatation takes place, heat will be generated. That is, you can say like acidosis. It may be metabolic acidosis. It will be generated, and because of that, bleeding will start. Okay. So tikshna, ushna, kshara, lavana, ati vyayam, atapa sevan, ati maithun, excessive intercourse, chinta, shoka, bhaya, tensions, anxiety, excessive screen time, going bed late at night, that also causes pitta prakop, drinking alcohol, smoking, drug addictions, everything, pitta prakop, rakta pitta vyadhi. Okay. Urdhva rakta pitta is a sadhya, adhoga rakta pitta is a yapya, difficult to cure, and ubhaya, up and down rakta pitta, that is asadhya. Okay. Let us see the pathogenesis. Pitta vardhaka ahara vihar, that I have already explained. Excessive eating of chili, spicy, pungent, sour and salty, all the time pickles and chutney, that makes the pitta prakop. Then rakta dushti by prakupita pitta, dushita raktastra, urdhva adh and ubhaya marga, and rakta pitta vyadhi will be there. Now I have to move on the most probably next page, but on the left side. Now we are starting very interesting chapter. Everybody is interested to know about Prameha, Madhumeha, Diabetes mellitus, and want the comparison. So my dear friends, this is Prameha Chikitsa. This is little bit, I am not agree with this title, little bit. This is treatment of the urinary problems. What I will say, urinary problems. It is not only diabetes mellitus or diabetes insipidus. Basically, they are all 20 urinary problems are mentioned in the chapter Charak Samhita, Chikitsa Sthan, chapter 6, Prameha Chikitsa. Now, Prameha is characterized by, can you see definition? Increased frequency and quantity of urination. Of course, as you know that prakarshene mehati iti prameha. There are lot causes for the increased frequency. Few important I will mention according to the modern science. You must do the urine routine test. Please note down, urine routine test, physical test, chemical test, microscopic test. Take albumin is there, sugar is there, bile salt, bile pigment, whatever, what, we check it, everything. Then see the microscopic whether there are pus cells, mild, moderate, abundant. So first reason we have to check the urine. So to rule out the urinary tract infection, because UTI, it may be cystitis, it may be nephritis. There is a possibility that the patient has to go to the toilet many times. That is first reason. Then you have to go for blood sugar, my dear friends, blood sugar. Fasting and post glucose. There is a confusion in between the students. Sir, what is F and PG and what is F and PP? PP is a postprandial. When the patient is a known case of diabetes, I will advise fasting and only PP. But if the patient is not having history of any medicine or the diagnosis of diabetes, then I will advise fasting and post glucose. 75 grams of glucose is given, and after taking that sharbata, exactly after 1.30, that means 1.5 hours to 1.45, because exactly after 2 hours we will have to check the blood sugar. So fasting and post glucose means fasting and after taking glucose sharbat exactly after 2 hours. Now there is one interesting test which can give you the average of last 3 month sugar control, and that is glycosylated hemoglobin test, HB1AC. Okay, that the number should be below 6. There is no unit 6, below 6, because it is a derivation or a mathematical formula. So now we are starting with the discussion of Prameha, and let us see only one point I will add in the increased frequency, that is the prostate enlargement, BPH, benign prostatic hypertrophy. But there, many times, one blood test is also done. Sonography, by sonography you do the diagnosis of benign prostatic hypertrophy. But there is one blood test which also doctor advised to the prostate patients, and that gives you idea whether the patient is having cancer of the prostate or not. Okay, that is a blood test. Anyway, we will start with the problem of Prameha. So first is a cause. This shlok is very, very, very IMP. So I will wait. You can write down. Asya sukham swapna sukham dadhini gramya daukanupara asam payansi gramya udak anuparasan mayansi payansi navannapanam gudavikrutam cha prameha hetu kafakrit cha sarvam. Very interesting. Huh? I will read again. Asya sukham swapna sukham dadhini gramya udak anuparasaha payansi navannapanam gudavikrutam cha prameha hetu kafakrit cha sarvam. So whatever the kapha prakopak ahar and vihar, that is bad for prameha. What is that? Asya sukha, sleeping in the daytime. Ayurveda says don't sleep in the daytime except, again the question of AIPGT, entrance examination, except after, in the Grishma Rutu, when there is a too hot outside. Yes, one can take a nap, NAP, in the afternoon. But otherwise, if you have the habit of daytime sleeping, you may get a diabetes after few years. Okay? Swapna Sukha. I'm sorry, there is a, again, slip of tongue. Swapna Sukha is a daytime sleeping, and Asya, tongue, Asya Sukham. I am craving for sweets. I want jalebi. I want gulab jam. I want kaju katli. I want pedha. I want each and every sweet, shrikhanda, gulab jam, basundi, etc. So that is asya sukha. That means it is indicating that you are going towards the diabetes. Dadhi, curd, but not only curd, all the fermented products. Please write down all the fermented products, or which will increasing the moisture in the dhatus, and that is called as a kled. So prameha, kushtha, these are the diseases of kled bahulata. Please write down this word, kled bahulya, kled bahulata. Okay. Now, also food should be not navannapan. It should be little bit 1 year old. Guda vaikrutam, all types of sugars. Now, what can be the purva rupa? The patient will start getting intermittent sweating, anga gandha, a typical foul smell, shithila anga, laxity of the muscles, and the patient is always feeling tired and weak. Kesha nakha ativruddhi, asthidhatu metabolic process, sara bhag is less and kitta bhag will be more. Galatalu shosh, thirst because of the excess urination, and karapad daha. This is also compared with the neuralgic complication of diabetes. That is called as a diabetic neuropathy. It can be also vitamin B1, B6, B12 deficiency. Whenever you want to give the polybion injection, please take care, because that can give you the anaphylactic shock. So unless and until you do the sensitivity test, don't give penicillin, that particular polybion, neurobion, and also the blood transfusions, like the what you can say, uh, in the conditions of B1, B6, thiamine, polybion, that I have mentioned, penicillin I have mentioned, and interferon. About anemia, I want to tell you interferon. These three injections can cause hypersensitivity reaction or anaphylactic shock. Yes, because the problem I have seen that Garapadda, can you see the cursor? That is diabetic neuropathy. And every doctor's neuropathy, neurobion. So be careful. We will talk about the samprapti. Can you see? Pathogenesis. Three types of the diseases: Kaphaja Prameha, Pittaja Prameha, and Vataja Prameha. According to the, there will be pathogenesis. In Kapha, Prakupita Kapha will attack on the Medha Dhatu, Maus Dhatu, and Basti Sthita, that means Mutrashe. There will be lot of Kleda Dushti, and Kaphaja Prameha will take place. In Pittaja Prameha pathogenesis, naturally Pitta Prakopa will be there. It will attack on the Medha Dhatu, Maus Dhatu, and there will be also Kleda Dushti, and Pittaja Prameha will take place. In Vataja Prameha, there is a Prakupita Vata, then it attacks on Vasa, Majja, Oja, Ityadi, and then Sthana Samshre in the Basti, and finally that Vataja Prameha can also take place. Now I will see, or I will like to tell you the Dushya. In the Prameha Vyadhi, there are 10 Dushyas. You know how the Vyadhi is generated? Dosha Dushya Samurchana Janito Vyadhi. The Prakupita Dosha are attacking on the weak Dhatu. And that's why in the first year BMS, we have in the clinical examination Dhatu Parikshana. Rather, it is called as a Dhatu Sarata Parikshana. So it may be the best quality, moderate quality, or the bad quality. So Pravara Uttama Sarata, Madhyama Sarata, or the Hina Sarata. Prakupita Dosha will attack on the Hina Sara Dhatu, and then the particular pathogenesis will start. So these are the Dushyas. The dosh on which element, body element they are attacking, those factors are called as a Dushya. Rasa, Rakta, Mans, Med, Majja. So these are the, and Shukra, 1, 2, 3, 4, 5, and 6. 6 dhatus are there. Oj is there. Ambu, liquid part of our body. Vasa is there, and Lasika is there. So these are called as a Dasha, Dushya in the Prameha Vyadhi. This statement, these particular names are very important. Prameha types, basically there are 20 types of Prameha. I think this is the time that we have to shift on the right side. And there we can get a list of the 20 Prameha with little bit comparison with the modern understanding of that particular problem. Of course, we are going to see that. I think this not related with our today's topic. This is a previous page. I am extremely sorry. I will continue with the Prameha from here. Kaphaja Prameha 10 times, 10 types. Don't forget this. For again, for MCQ, AIAPGET. How many? Kaphaja Prameha 10. Pittaja Prameha 6. Vataja Prameha 4. Keep it in mind. याद करने की कोशिश कीजिए. कफज प्रमेय 10, पित्तज प्रमेय 6 और वातज प्रमेय 4. उसके नाम भी आपको याद करना ही पड़ेगा. उसका एक्सप्लेनेशन तो दिया है हमने. We have the description, but let us see. उदक इक्षु सांद्र. Don't go for Meha word. Don't remember the Meha. Only Udaka, Ikshu, Sandra, Sandra Prasad, Shukla, Shukra, Shita, Shanai, Sikata, Lala. So remember these only 10 names. Udaka, Ikshu, Sandra, Sandra Prasad, Shukla, Shukra, Shita, Shanir, Sikata, and Lala Meha. Pittaja, 6. Can you see the names? Kshar, Kal, Neel, Haridra, Manjishtha, and Rakta. Kshar, Kal, Neel, Haridra, Manjishtha, and Rakta. And Vataja Prameha, only 4 types: Majja, Vasa, Lasika, and Madhumeha. This word is very important for you. Here, can you see? This is the last part of Vataja Prameha. All the tissues are damaged and the urine becomes like a sweet honey. So that is named the Madhumeha. Okay. So let us comparison with one by one how that Ayurvedic words can be correlated with the modern terminology. Udak, the urine resembling water. That means its density will not be more and more watery. So it can be compared with that diabetes insipidus, where the specific gravity is fixed around 1.010. Okay, so that is Udakameha. Ikshu, the urine resembling by appearance sugarcane juice. Sandrameha, urine having the high density, that is thick urine. Sandra Prasad, precipitating, that is high density in the lower layer of the urine. Shukla Meha, the urine having white color. Shukra Meha, the urine containing seminal fluid. Then Shita Meha, the urine which is cold in touch. Shanir Meha, the urine is passing out dribbling micturition. Shanir Meha is like a dribbling micturition. It can be in the prostate. Okay. Then Sikata Meha, the urine containing sand-like particles. And I think this is for the Kafaja Meha. Now we will talk about the Pittaja Prameha. Okay. So Kshara Meha, the urine resembling the solution of alkali. Kal is a black color. The urine having black color. Neela Meha, Neela means blue. The urine having blue color. This is very, very rare possibilities. Haridra Meha, the urine having yellow color Haridra, like for example, infective hepatitis, Kamala, there you get the Haridra Meha. Manjishtha Meha, the urine having reddish color like Manjishtha. For example, you can get hematuria, especially when there is a stone, urinary stone, calculus, the urine can be red color. Rakta Meha, the urine having directly blood. Just now I have mentioned it may be because of some cancer growth, or it may be because of the nephritis, cystitis, ureteric problems, stone problem, and there may be what you can say the autoimmune type of reaction. So hematuria will take place. Majja Meha, the urine mixed with the majja or bone marrow. Vasa Meha, the urine mixed with the vasa or the muscle fat. Lasika Meha, the urine mixed with lasika or nymph, or the patient urinates more in quantity like an elephant. That is called as a polyuria. And lastly, the Madhumeha, that is urine mixed with ojas. I think I will have to move on the page number 4 and turning my script on the left side. We are discussing Charak Samhita, Chikitsa Sthan, chapter 3, Jwara Chikitsa. I am sorry. That is already finished, 3rd chapter. 4th Rakta Pitta finished, 5th Gulma finished, and now this is 6th chapter, Charak Chikitsa Sthan, that is Prameha. Okay. So, Sadhya Sadhyatva, Kafaja Prameha is definitely Sadhya. Pittaja Prameha is always Yapya. Vataja Prameha is said to be Asadhya. Prameha is incurable, that is Asadhya, in the following conditions. That is Prameha, Pidaka Yukta Prameha. Can you know this word? Please write down. Diabetic carbuncle. Sir, carbon? No, it's like ulcer. Here, it is always taking place on the neck. Diabetic, I am repeating, diabetic carbuncle, 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 like a vrana, okay? Jata Prameha and Madhumeha, they are supposed to be especially asadhya. Now, the most important thing of today's lecture is this Prameha Chikitsa Sutra, basic management principle. स्थूल प्रमेहि बलवान हैकः कृशस्तथैकः परिदुर्बलश्च संब्रूहणं तत्र कृशस्य कार्यं संशोधनं दोष बलादिकस्य. So basically Pramehi patients are of two types. One is a sthula Pramehi. Of course, when there is a cough, strong and stout. Sthula Pramehi, that is Balavan Pramehi. So these, when the physical and mental strength is great, you can go for panchakarma, detoxification. But if by chance this Pramehi patient is a krusha, weight loss is there, then better you should not give the Shodhana Chikitsa, but you can give Shamana Chikitsa and Bruhana Chikitsa. Okay? Now, what type of the panchakarma we do in this Sanshodhana Chikitsa in the Sthula patient? Let us see. First, these patients, obese patients, they must stop the Nidan. So how? If they are having sedentary lifestyle, do the regular walking, running, sports, exercise is mandatory for you. If you are overeating, stop, control it. For control, you can do the meditation. For control, you can start walking. For control, you can keep your mind engaged in the hobbies, ethical hobbies, and that will relieve from your overeating problem. Stop eating the sweets, fatty substances, high calorie food, everything should be stopped. Then you can give the Shodhana with Tikshna Vamana or Tikshna Virechana as per necessary. We can use the Basti, medicated enema with the Tikshna, Ushna and Ruksha type of the herbs in it. Kapha Medohara Chikitsa. The best is a Takrarishta. Takrarishta. Then another medicine is a Mustadi Kwat. Musta means Nagarmotha. And Madhudaka. Madhu is honey water. You can ask him to take honey water. Then the person should increase step by step exercises. Jagarana, that means, especially, I will not say you can stay at night, but another you can say that you should not sleep in the daytime. Jagarana means don't sleep at the daytime, keep it awake yourself. Read something, hear the audios of Dr. Deshpande and keep yourself engaged, you will not sleep. Okay? Chintana, Manasik and Sharik Shrama are there. So one has to make what you can say, the not relaxing all the lifestyle, happy-go-lucky, but sometimes they can be a little bit serious and think of the different possible scientific inventions. Or you can think of family affairs. You can think about your performance in the business, performance in the as a service. This is called as a mental shrama, and sharik is of course the exercise, swimming, running, jogging, etc. Now the patient in front of us is not strong and stout, but the patient is very, very weak, low weight patient. Height weight chart, the weight loss is there. So of course there he should not do the excessive opposite to above. So he should take a proper test. Don't unnecessarily run from here and there and try to achieve your targets. That is called as a rat race. Rat race. That is not allowed for this Durbala Pramehi Ruguna. They can use the Rasayana and Vajikarana, tonics and aphrodisiacs. Manth, Kashaya, Avaleh, Yavan with honey. Always use the honey as a Anupana. Abhyanga, Unmardana, Pradeha, application of the Lepa, Parishek. like a dhara, kayaseka, or the pijichil, or the pidichil, or the avagahasve. Manasik or sharik vishram. Take the physical and mental rest as much as possible. We are on the page number 4, and I have to move the screen on the right side. Charakastu Chikitsite. We are learning Charaka Samhita. We are learning Charaka Samhita Chikitsa sthana. I think this is starting of the 4th page. Kafaja Prameha Chikitsa Shaman. Okay. Apatarpan should be done in Santarpana Janya Prameha. And then we can give the Vamana, and Santarpana should also be given. Mantha, Kashaya, or Leh, or Yavachurna. Yes, we have to consume by the patient. We are asking the patient to take these substances, add these substances in your lunch or in your dinner. So there may be some home remedies. Haridra Churna, turmeric powder with honey, with Amalaki Swaras. Actually, this formula is given in the Vagbhat also. The use of turmeric, use of the Haridra. Nisha Amalaki Yoga. Nisha Amalaki tablet is also available. Nisha means Haridra. Okay. Kapha Prameha Nashak, Harittakyadi, Dasha Kashaya Yoga should be used. In Medovruddhi, best remedies by Charak. Triphala Gugulu. Here not Gugulu mentioned, but Triphala. I am 100% telling you, my dear friends. My senior friend, which is no more, Dr. Prakash Palanspe, he has done the clinical trial of the medicine Triphala Gugulu of Ayurveda Rasashala Pune Company. Tried for 100, 200 patients and published his paper in the Lancet journal. Very famous, internationally peer-reviewed journal, that is Lancet. Lancet. There he has published the paper. He said that Triphala Gugulu, 4 tablets, 4 times in a day, QID. 4 in the morning, 4 in the afternoon, 4 in the evening, and 4 at night. That is there. Triphala Gugulu definitely reduces the weight. Okay, so you must try for it. Then Guduchi, bitter plant, Tinospora cordifolia, Shilajatu, bitumen, black bitumen, honey should be used. Now we are talking about Pittaja Prameha Chikitsa. For Pitta, we always advise the Virechana, but after Virechana, we must, what you can say, maintain the health or the nutrition of the patient. So Santarpana Chikitsa is advised after purification. Pittaja Prameha Nashak, there is Ushira, Lodra, Adi, Dashakashaya Yoga. Separately they can be used. Last is a Vataja Prameha Chikitsa. Basically, Vata Tatra Ruksho Lagu Chitaha Kharsukshmascharo Nilaha. Here we can use the Sneha opposite to the Ruksha. It may be medicated ghee, it may be medicated oil. But while preparing this oil or the ghee, specifically that manufacturer, Ayurvedic Vaidya, should use the Kapha Pitta Prameha Nashaka Aushadhi in that particular medicated ghee or the oil. My dear friend, this is the last, really last point of the Prameha Vyadhi. This is also AIA PGT. Entrance examination, it is always asked, how many Pidaka, Prameha Pidaka there? 4, 7, 3, 8. You must write down 8, and then names are also put, always asked. This can be the short note for your examination. Prameha Pidaka, short note. Write down. Charavika Kachapika Jalini Sarshapi. Charavika Kachapika Jalini Sarshapi. Alaji Vinata Vidrati. Alaji Vinata Vidrati. So these are the names of the Prameha Pidaka. For the management, sometimes minor surgery can be advised. Then Vrana Shodhana and Vrana Ropana is done by the Ayurvedic management. Some medicines which can be used internally, like decoction of Daru Haridra, Triphala, and Musta. Daruharidra, again Kledanashana, Trifala, all are Kledanashana, but Trifala is my laxative. Musta Nagarmutha, best Amapach. Phalatrikadi Kada is available in the market. Lodraso, available in the market. Dantyaso, available. Madhudaka, Madhu and Udaka, Madh and Udaka, Sarodaka and Kushodaka. Now, what is the best food for the Prameha Vyadhi? Yava Churna or Sattu. Mudgayusha, that is green gram. Purana Shali, Shali is a rice. Sarshapataila, Patol, Karavellaka, and Madhudaka, means Madhu plus Udaka, that is honey water, etc., can be used as a Shaman Aushadhi in the disease of Prameha. So, my dear friends, this is all about the Charaka Samhita Chikitsa Sthan class of today, where we have discussed the Vishama, Jwara, Nashaka, different Kashayas, Santata, Satat, Anyet, Drititya, Chaturthaka. These are the types of Vishama Jwara. And we have completed the Jwara Chikitsa, chapter number 3. Then, as I have told you, chapter number 4 and 5, Charak Chikitsa Sthan, Rakta, Pitta and Gulma videos are already there. Please check it. And today, chapter 6, Dr. Deshpande has finished, that is Prameha Chikitsa. My dear friends, this is all for today. Let us meet on the Monday for the Roga Nidan lecture. Thank you very much. Take care and see you soon. Please don't forget to subscribe my YouTube channel. Thank you very much.